Tansen, welcome and thank you for me being here. My name is Wayne Burnstick. My traditional name is Asneowasis, which means rock child in the Cree people. And I'm employed through Alberta Health Services here in Edmonton. I work closely with all staff with Alberta Health Services here at Royal Alexandra Hospital. And I come to you from the Indigenous Health Program in Edmonton. My role is an Indigenous cultural helper, and it is a very unique position. It's the only one in Canada and nationally that we're able to be recognized as cultural helpers in the healthcare system. It is quite the honor to be able to walk in both worlds, in the Western world and the Indigenous world, trying to provide care for our people. It is very important to us when we talk about traditional ways and traditional medicine, the traditional ways of knowing and educating staff in regards to what our ceremonies mean, why we do what we do in traditional ceremonies at bedside. I was quite involved over the last 9.5 years to be able to be with many of my people at bedside. And it's we talk about patient-centered care, but also to remember it's about spirit-centered care and how we present ourselves around the patient. Family plays a big role in what we do in the Indigenous country. You'll notice that when someone is sick, we have large families. It's usually the whole community that comes. That is about acknowledging the patient, and we do that with many ways, with ceremonial processes at bedside. When we talk about spirit-centered care and patient-centered care, in the Indigenous world, when we do traditional ceremony, we are so connected to everything on the outside of this place. From, of course, Mother Earth, we're so connected to the birds that fly, to the animals, to all our ceremonies that happen across this land, because that is food for our spirit. So when we do that, we have to always acknowledge that a patient in some difficulties are traveling to the spirit world and back at the very sickest point of their being here. So they are trying to decide if they're going to be here or travel on to the spirit world. It is that sometimes we know and doctors will say, well, there's not much we can do. And that's true. Then it takes the spirit world now takes over. So a lot of times our patients are declared, they're going to pass away, but they are sent to the spirit world, but they're also sent back because their job is not done. So it is my role, I guess, as an educator as well, to educate staff around the unit itself, to ensure that the that the gifts of life are really acknowledged, of love and kindness, honesty and sharing, all them 7 gifts of life that we're given to use with every human being in life. That's how we walk, that's how we treat our patients. So it's important for us to also include our traditional knowledge keepers when these things are happening. Our elders are quite involved in what I do. But it's, I can only speak from the traditional perspective because of the work that we do as cultural helpers in this site and at U of A Hospital. Alberta Hospital is the same thing. Treat the spirit. Treat the patient and the spirit. And chances are our patients are going to get well a lot faster.